Welcome to the Gut Girl Podcast. So, today we have with us Anastasia Auld, who is a fantastic, experienced, registered counsellor and psychotherapist working in Melbourne and also online. Thanks for being here.
Oh, thank you for inviting me. It's a pleasure to be here and just share the space with Georgia May.
Oh, I'm really excited to have you here for so many reasons. One is that I first discovered you on Instagram because your reels are so unique. Like the way that, if you haven't seen them, you got to check them out. Anastasia's reels are just so, authentically you and to the point, they cut through the bullshit, I don't know if I'm allowed to say that, but anyway, they cut through the bullshit and they are so well informed in terms of just your psychological background, your training, who you are as a person. I just so resonate with. So
Thank you very much, Georgia May. I think it's really the format in Instagram really making you to get to the point quicker.
Yeah,
because you can't.
The algorithm makes sure that you get to the point.
You can't use the luxury of time, and I just try to target to my audience what they are looking for, what their pain is, and I'm doing it not for so long, so I'm not an expert in the field. I'm just a counselor who is working with clients in my office.
The reason Anastasia is here today and why I'm so excited about our chat is that we know that stress impacts the gut. I've lived that, and that's pretty common knowledge now. And then, of course, the more stressed and messed up your gut is, then your head, there's this lovely little cycle going on where your sort of head's getting more stressed by your stressed gut, and then your stressed head stressing out your gut, and it can be a nightmare to intervene in that. Mm-hmm. And one of the ways of obviously getting your stress down can be going to therapy and having that support. And for me personally, that was a big deal, a big part of my journey. So from my point of view, the overarching, goal of today is to try and, give people a sense of what the kind of answers are to the commonly asked questions about therapy. What is it? Why would you go? What's the point? The different types of therapy. Yeah, I just feel like you are, you're a wonderful person to be answering these questions, of which I have many, about therapy. Because I have some friends and some family that, would be really unsure about what to expect, like when you're going to therapy. And it can be pretty intimidating, I feel like.
Could be, yeah. Yeah, we have so many misconceptions and I think about therapy, and it is intimidating in some sense because it's basically that only time sometimes when people need to talk about themselves.
Yes.
A stranger who they're seeing first time in their life. So no wonder why it could be intimidating, scary sometimes.
Yes.
And some people don't understand how talking for 50 minutes or 1 hour can help.
Yes.
So, and I'm happy to be here and talk on this endless topic that I can talk endlessly. Yeah.
We'll have to probably keep it to an hour, but that's gonna be difficult. But we'll just see what we can get through.
Yeah.
Because I suppose my first question, in terms of a place to start, if you were someone who'd never had therapy before, and maybe you had no family that had therapy as well, so like there's no familiar experience with it, what would you be trying to look for when you're seeking out your therapist? Like what would be important to maybe, I don't know, hold in mind or to be trying to think about as you're trying to find the right therapist for you? Yeah.
All right. It's a great question. I think what is very important to know that therapist is a human, right? We have some maybe a picture in our head that therapist is an expert, and this person knows better how to organize your life, how to live your life, what to do, how to work out the current challenges you have. And it's kind of putting automatically by default some authority on the therapist.
Yes.
And a lot of people feeling a little bit superior once they're entering the therapy, especially if they're in their mid-20s, 30s, right? When they're not that old and mature, they come into therapist and they see the therapist as an authority figure. It's very common, like from my practice, I would say.
Okay, for them to
Yeah.
go in and
And
you
you
feel quite
feel-
inferior, like
yes,
there's a power
yes,
imbalance.
yes.
Okay.
Just because you need to be very open, vulnerable in this moment, this vulnerability already putting kind of the power imbalance
Yeah,
there.
absolutely.
And the first thing that I want to our audience, our viewers to know, that you need to feel comfortable and you have a choice, right? You can change the therapist at any point, and you can have like a little bit play here. So what I mean is try different therapists. Some people would say, "Oh, therapy is expensive. How can I change therapist and just to find the right fit?" But I think the right fit is very important in therapy because it's very
Okay.
sacred place. It's a place where you like putting on the table all your fears, let's say your thoughts that you would never verbalize to anyone else. And the relationship with therapy is a key factor of efficiency and productivity of the work together. So the
Right.
therapy relationships between you as a client and your therapist is number one factor for this therapy to go well, for this therapy to bring you results, for this therapy to change the patterns or relationships that you're hoping to change through the therapy. So I think the
Such an important point.
human factor, person factor is number one factor. So I think it's very important to find someone you can be relaxed with. Maybe you can put your guard down. And sometimes it's taking few goals. It doesn't mean that you're just doing this like first session, like an interview and seeing how you feel. Sometimes it's very important to just, once you're entering the room, sitting in this room, to just do the small self-check, like, internal check, how this room makes me feel, how does the space resonate with me, how does this person in front of me make me feel? Can I put my guard down? Can I be
Yes.
a little bit open? Not necessarily straight away to tell about all the things. We're all different, and some of us need a little bit of warm up that can last half a year, but still, you know what I mean? If you feel that,
Yes.
yeah, this person is kind of clicking with me, I can talk with this person, I can trust, I can give this person a chance, then you should continue. If you feel that this person, it's not necessary about the bad therapist or good therapist, I'm talking about energy in the room, I'm talking about your inner gut feeling.
Yeah.
If you feel that, yes, you can, and yes, I can put my guard down with this person, this is the first good sign that this therapy could be productive, and could be your therapist for life or for this particular life stage.
That's such an important point you make about how just culturally, you can go into a therapy appointment and feel like, oh, I need to listen to what they say, or I must assume that they're fantastic and amazing and the right
Because they've done all of these studies and
Yep.
they have the qualifications, and and even your best friend, which is ethically doubtable, but still your best friend could see the same therapist and you think,
Yep.
oh, my best friend just got such an amazing results with this person. But it's work with the human, and I think the spotlight of this work is still on the relationships. Your relationship is in therapy setting the blueprint for your relationship with people in your life, either romantic relationship or friendships or work related relationship, etc. So these relationships crucial. They are most important part of the work you're doing. So think about your therapist as a human. Is it this human that you want to meet once a week
Yes.
for the next months, weeks, years?
Yes. Oh, I love that. I appreciate you really trying to give people permission to check in with themselves and go, hold on, is this feeling comfortable? Is it not? Do I have a gut feeling that suggests this is not right, not for me, or a gut feeling that's saying, yep, we're okay, this is okay, I can give this a go, it feels comfortable.
And of course, we have some clients, some of my clients, I'm not the first therapist they saw. Like some of my clients was saying, like, I saw a male therapist before, I didn't feel very comfortable with him, and I just doing a check here. I want to try a session with you and see how it goes. they giving straight away, they're sharing their intentions, etc., and it's completely fine. So the therapists also understand, most of therapists,
Yeah.
like
You'd hope so. Yep.
yeah,
But
that it's not about them as person. It's sometimes about the comfort of the client and the choice of the client has. And some of us, again, having this fears about superiority of therapists, but some of us not. Some of us are happy to go and explore and try different therapists. My living experience also showing me that I tried different variety of therapists
okay,
in my life.
yes.
And back then, when I was younger, in my 20s, early 20s, when I started my therapy journey, I felt like obligated and very loyal to the therapist. And I felt that I
Right.
can't change. And it has a lot to do with our, again, inner settings and our
Absolutely.
inner picture of what loyalty is and how we can leave relationship or stay and tolerate relationship. But I think for someone who is watching us today, if you're thinking about therapy, I just want you to know that you always have a choice, and good therapist, professional therapist, will not only accept this choice of yours if you decide to change the therapist or explore who else can help you or can work with you together, they also will, I think, will appreciate it. And I think this
Yes.
is important.
Yeah, I suppose in a way, the therapist, appreciating that and being on board with that is a
Yes.
way of them saying, "Hey, well, no, I trust that you actually know
Mhm.
yourself well enough and your body well enough to know what feels right and doesn't feel right."
Yes,
And
of course.
yeah, what would you say is what are the kind of things do you think that you should expect when you go to therapy? I mean, do you think you should expect to go in there for like one session, for 10 sessions? How much do you think you should expect to go, and what is a reasonable kind of set of expectations, I suppose, to have going into therapy?
I think we're
Yep.
all living in a society that results driven. We all want deadline. We
Yeah.
want to know
Mm-hmm.
how much it will cost, how
Yeah.
long it will take,
Absolutely.
etc. And I'm on board with that. I'm the same
Yes.
human who value my time, money, and try
Mm.
to optimize everything. However, unpopular
Yes.
opinion here, therapy takes time because relationships, to build a relationship, it takes time. To sustain the relationships, it takes time. And if you just imagine that from the beginning, once you were born, you were building relationship with different people in different areas of your life. These relationships created a particular template, I would say, the blueprint inside of me, or internal settings, how you relate. How you relate to friends, to loved ones, how you relate to your colleagues, to your kids. To change this template, why we need to change the template? If you're facing difficulties and big challenges in communication, in love life, for example, you're struggling to find someone, or you're struggling to sustain the long-term relationship, or you're finding yourself just generally unhappy with your life, if you're feeling depressed or quite anxious, etc. It's all through the relational lenses. It's all the problems that we are addressing in therapy. But we're not only addressing them cognitively, which is part of it. Let's say cognitive behavioral therapy. It's one of the approaches of therapy when we're trying to process everything analytically through your head. But big part of therapy is processing everything not only cognitively, but on emotional level. It's creating new emotional corrective experience. Then you can take away home. But to be able to take away it home from the therapy room, you need to feel it. You need to sit with it. And your body needs to know what it is like to be in a safe relationship, what it is like to be enough, let's say so, for someone, what it is like to be accepted, what it is like to be understood, seen. And I think this corrective experience needs to be relieved over and over again until you're able to use it in your life outside of therapy room. But it's not happening like, oh, today I will use my corrective experience. It's happening automatically. It's happening
Yes.
subconsciously. CBT, again, that we just mentioned before, cognitive behavior therapy, it's working mostly here on the level of cognitive level. Yes, we will do homework. Sometimes your therapist can give you homework. You will practice something with therapist and then
Right.
implement it outside of the room. However, overall, how therapy works, overall therapy, right? Medium-term therapy, not short-term therapy. Short-term therapy, we will say 10, 15 sessions.
Okay.
We're talking about medium-term and long-term therapy for bigger work or bigger issues. It will take time, sometimes up to 1 year, sometimes longer.
Yeah.
It depends. But what I want to say that when you're coming to therapy, you wouldn't see a particular result there in the room. You would see how the results unfolding in the course of the next months and years in your life. And sometimes to collect these dots together, to put the full picture together, it takes time to look back where you were there before you entered the room and where you are right now.
I feel like the issue of going through the process of, getting comfortable with your therapist and doing the work, it's sometimes the absence of things like, oh, I'm not as hard on myself, or oh, I'm not as not as tense, or it's sometimes hard to notice the absence of a symptom or a struggle, but that can be
100%
in the mix.
100%. It's very easy to get used to a good life, and it's very hard to notice what is not bothering you anymore, right? It's when your anxiety is reducing, you're not noticing that your anxiety is reduced. You're noticing actually life because you're more present. And the same with depression. When your depression is gone, you just start living normal, average life. It's hard to notice, right? But it's a huge difference. And I absolutely agree with you, Georgia May, here. Sometimes it's not the results that you can see when you get better, but things became like easier. Sometimes it's the results that you can't see, but they are not bothering you anymore.
And I can imagine that some people would say, well, hold on, I'm struggling, let's say, with, feeling really stressed, or let's say my gut is on fire and that's stress related, or I have a very critical in a dialogue, whatever it is. Why would I go to therapy to talk about that? I'm trying not to think about it. Why would I go and talk about it and think about it for 50 minutes a week? Isn't that going to make it worse? I feel like that is a question that a lot of people do believe, 100%. And they think, hold on, what's the point in that? Why would I open that box?
Because I started talking about relational lenses of therapy, while the topic of this podcast is gut health, right? The main thing, how is it related? Relational experience and gut health. So we know from evidence, from research, years of research, that gut is very sensitive to stress. Our nervous system is very sensitive to stress too, but gut is kind of physical variation of it, right? That you can physically observe and feel. So the level of stress that we're experiencing, one, it's very high and the stress is prolonged, it's affecting our gut. Stress is coming from all different aspects of our life. But name the problem, and in the end of this problem, in the down of spiral, it would be a relationship with someone. So why relational experience is important? Because relational experience is causing us stress. Prolonged stress usually leads us to any type of problems. High anxiety, inflammation, gut stress, gut issues, any physical problems, name it. Our body and our mind are interconnected. There is like so much evidence right now that our nervous system and our gut, not separating them. The mind and body are interconnected. Some symptoms are medical, some symptoms are psychological. But most of the symptoms, they are integrated between these two. They are physical and they are psychological. So why it's important to come to therapy while you're having, for example, gut issues, because therapy helping you to address any causes, any roots of the gut issues. And one of these, most of the time, is prolonged stress.
Yeah, which, I mean, you're saying is is relationships are so foundational in how your nervous system operates and how you feel in your body. And I mean, I wonder where, when I think about, okay, going to therapy and it feeling scary and intimidating to go and talk about the stuff that haunts you or that,
Mm-hmm.
consumes you or that you try to avoid, the process of going to talk with someone about that, why that's ultimately, if you stick with it, more likely to help you than hurt you.
Mm-hmm.
Um, I wanted to ask you about the relationship that you have with yourself and how that, how you would work on that in therapy. I mean, what that looks like. You talk about how important it is to feel safe in
Mm-hmm.
your relationship
Mm-hmm.
with a therapist. Why does that matter? Particularly so if you're terrified to go into therapy to talk about certain things, because let's say you're really vicious in your own head, you're
Mm-hmm.
horribly hard on yourself or whatever it is. Can you tell me a bit about how you would work on the relationship you have with yourself in therapy?
Of course.
Yeah.
I think it would be a little bit from psychodynamic lenses here, but I think it's the best way to describe it.
Mm.
So just imagine that we have this inner dialogue, right? All of us having it when we're watching yourself in the mirror in the morning, when we're looking in the mirror in the morning, and when the jeans are not not quite our size, etc.
Yeah.
When we're parking in the wrong spot or we're forgetting the keys, the inner dialogue is very, very loud.
Mm.
We can think that it's our inner dialogue, but the theory is showing us that this inner dialogue is created by other voices that we were hearing back then in childhood that was shaping us. It's not solely our inner dialogue. It's a dialogue of the main kind of caregivers about us, about life, about people in life, and it's all tied up with our beliefs, of course. So what I want to say that this new corrective experience, emotional experience with your therapist can influence this inner dialogue. And you can say that why do I need to go to therapy then if can have supportive friends, right? Circle of friends
Yes.
or my significant other who admires me and very kind to me. This is all counts. Like all of this, like protective.
contributes.
Yeah, of course, it contributes to improved inner dialogue. It contributes to improved self-esteem and self-worth, etc. It's all shaping you on a daily basis. But it's kind of uncomparable thing when you in a special place, even if it's online, it's your special time when you with someone sharing this time and talking about yourself, being able to self-reflect, being able to be navigated inwards towards yourself. You're getting undivided attention from your therapist. All of this, I would say, healing, and all of this are contributing to new vision of self that you're gaining through this interaction.
Yes.
Sometimes it could be cognitive insight about yourself. Your therapist could say something, it's bringing you insight, and you're realizing that things are very different from what you thought they are about yourself. Sometimes it could be just a somatic experience. Your body just feels off guard. Your body just feels safe. And it could be a rare experience because, for example, you're stressed at work and you have little social anxiety when you're meeting people at work and outside of work. I mean, so your body always carrying this guard on. And only in therapy space, sometimes it's the only space where you can embody different experience. So all of this contributing to your sense of self, to your self-worth and your inner picture of yourself, inner dialogue as well. So ideally how we want it to work, that as far you're going in therapy, as more you're changing this inner dialogue and it's becoming more compassionate, kind, if we're talking with females, so you start treating yourself like your own daughter.
Oh.
Yeah. Ideally. Sometimes it takes years.
Yes.
But ideally it is what it is.
I mean, that's such a helpful way of understanding how that work goes on. Because I think sometimes you go into therapy thinking, all right, I'm going to get some strategies and I'm going to walk out from one or two sessions.
And
with
sometimes this is what people need, right? We're talking
okay,
about
yeah.
high functioning professionals who, for example, have no trauma background, generally having high quality of life, and they experience, for example, just once in a while, very tough period of time at work.
Okay.
They like a highly stressful period of life. They can see a therapist, and it's working more like a consulting, let's say. So a therapist helping with cognitive strategies, they're applying the strategies. The person is getting unloaded in the room. Still, when you're talking about your problems, it's helping you to unload mentally, emotionally. I think everyone experienced that. Once you talked about something through, you feel less kind of
Absolutely.
tense and less overwhelmed by it. So this is one of the aspects of therapy, right? And sometimes this consultation, consulting kind of format can help people to solve their issues or to support them through very tough, like one-off period of time. And it's like 5 to 10 sessions, and there is nothing wrong with that.
Okay.
From my experience, people who came to see me,
Yes.
they think that it will take them 5 to 10 sessions,
Right.
and it's one-off experience just with their roommates or just with their colleague or just with this particular partner of theirs. And then other things like popping up. And once we're able to bring them to surface and look at them, we're realizing that there's something going on much deeply, some patterns, underlying patterns and cycles that we can work on. And I'm quite transparent with the clients. I'm always saying like, look, this is not something, especially when they're coming and talking about attachment. You're working with attachment. I'm anxiously attached partner. I'm having panic attacks when my partner is late at home from work or from nightclub. Can we fix it with strategies in 5 sessions? I'm always saying, look, this is very, very not a hard but long work.
Yes.
It's attachment. It's very deep work. We need to think about years, like at least months.
Yes.
Not few sessions. I can give you strategies. And this is what I usually do because this person came first time. They didn't commit to long-term therapy or anything.
Right.
I will give them strategies, what they can do in these moments when they're having panic attacks and the moments when the anxiety is just over the roof. But I know that it's just a band-aid.
Right. Yes. And in a way, I mean, when you go into therapy and you've got physical problems, so, that let's say you've seen all the doctors about and no one's been able to fix, I guess that's something that's sort of worth exploring a bit together because I think often people do still treat, like maybe their gut issues or like a skin sort of maybe rash or something, all these sorts of bodily things that can go on, maybe, I don't know, being sort of shaky or as physical. But can you tell us a bit about what is the emotional component to that? Where could that fit in? How would therapy potentially help with those kinds of physical problems?
I think this is what we just talked with Georgia May just before the podcast.
Yes.
That the research now showing there is no kind of separation between the body and mind. It's already well researched and well proved that body and mind connected. For our nervous system, there is no separation. Neither for our gut. There is no separation between body and mind. That means that we have 2 doors.
Okay.
2 doors.
Yeah.
You can choose either. You can go solely into body's door, right?
Right.
Go and get a medical advice. This is I'm not against it, actually.
Yes.
I think it's very important. So go through the doors of the body.
Yes.
And go through the doctors, have all the checks done, try medicine, try the protocols that they're prescribing. This is a great way to do that. You just remember that you also have the other door. And going to one door doesn't mean that you're closing or shutting the other. I prefer to have all my options as a person. I
Yes.
prefer to have the car and the bike if I can, you know?
Yes.
Just
That makes a lot of
just
sense, the
keep
idea of the doors.
keep the doors open.
Mm,
And
mm.
sometimes, like, we need to remember that we are humans. We are very unique creatures. What will work for one person can be not helpful for the other, even though the
Yes.
symptoms are the same. I'm saying that because I'm seeing clients in therapy, the anxiety that presented in one client and the anxiety that presented with other client could be treated similar ways, but one thing will work for one person and will really significantly reduce this anxiety. Once I'm doing the same techniques, the same interventions, everything with the other person, not
Yeah.
working.
Okay.
The person is not responding to it. So this is why I'm saying that keep your options open for you. So while you're trying all the medical way to reduce the symptoms, like physical symptoms, try to go through another door too. Psychological symptoms are very important. Psychological door, I mean. So in the end of the day, as I said before, they are interconnected. So just think about every investment, every dollar counts here. So every investment that you've done, either in medical door or in psychological door, it all counts in your bank account of your healthy gut. And
It's a nice way of actually,
maybe you will
understanding
benefit again from one door more than another, but it's definitely not the way to harm yourself or to make it worse.
I mean, yeah, it's funny because even if I think about my experience of going to therapy, and I needed quite a bit of. You mentioned how sometimes your therapist kind of operate to um, uh, calm your body down and your nervous system down. Sort of you can use that relationship to kind
Of
of
course.
like there's the
Yes.
unloading and the
Yes,
can
of
hear me,
course.
understand what's going on, but also that kind of like I mean I needed quite a lot of that before I could even sort of start to think and reflect and get into understanding
Yeah,
myself more or what I needed more or and so
of course. And when I'm talking about this second door, psychological
yeah.
door, right? And going through therapy, the therapist also has different doors to open with each client. One door is, again, cognitive analytical door. It's what we were talking about. Cognitive behavioral therapy. Let's talk strategies.
Right.
Let's write a diary. Let's do this homework and start to writing your thoughts down. Analytical door. The other door is somatic door, right? It's somatic experience. I will ask Georgia May to just take nice and deep breath in through your nose and out for 4 counts down to somatically kind of relax the body, to move body to parasympathetic state, the
Right.
state that we need, where the digestion actually happening, right? I can use
Yes.
this door. And it's also different kind of approaches that we can use. And the other door is feelings, right? I just told you about somatic experience, about cognitive way of processing it, and feelings. When we can focus on the feeling and just go down this feeling, like, where are you feeling that, Georgia May? You would say, for example, I feel tension in my chest, for example, and we're following the feeling. And different clients will be better at one or another door. You know
Right.
what I mean?
Yes.
And the
Yes.
therapy can be very different with different practitioners because we have somatic therapy practitioners who are using
Okay, yeah.
primarily, right, the body and body experience. We have cognitive behavioral therapists who using particular cognitive abilities and analytical kind of way of solving problems. And we have practitioners who emotional focus therapists, and they are focusing on emotions and following emotions. Majority of our therapists, I don't know the statistic exactly, they are integrative. They're using integrative approach. They know different approaches, they study different approaches, so they integrated them together and they use them in according to what the person needs. This is what I'm doing in my practice. And this is how, at the moment, what I found Australian like educational system who trainings counselors and therapists kind of suggesting. It's giving you basic education, I would say, a little bit of overview of different approaches, then you're graduating and then go and get particular training done to be trained in particular approach and
Yes.
be a good therapist. Yeah.
Yeah, I mean, that's a tricky one, isn't it? Because if you go to your doctor, I would imagine, and this is my experience, generally speaking, they're all kind of operating from the same framework for the most part, or a similar framework of like, okay, yeah, we're using this framework to understand your physical problem
Yeah.
or your whatever problem. But if you're going to a therapist, there will be so much variation in the
Definitely.
framework from which they are understanding your experience.
Yes.
Is that right? Like there's just so much.
It is. It's just very different languages. So I'm like they can speak different languages, but they
Yes.
speak about the same thing. And sometimes, referring back to your first question, what you're looking in the therapist, sometimes you feel good about your therapist, for example, you feel safe with the therapist, but at a certain point, you realize that you want to try something different. You know, that maybe changing the approach, changing the particular way your therapist working, the framework. So as I told you just before, when I had a lived experience of PTSD in my life, I needed to refer myself to a different therapist, additionally to my current therapist, to just clear the trauma, clear the PTSD with EMDR techniques. Not every therapist works with EMDR particular framework, right? So it's sometimes this approach is also important at some point of your journey with a therapist, but it could be different. And you have the right to ask at the first session with a therapist, what approach do you use? You know, how do you work? Like what? And every therapist would be happy to describe you what approach they use.
Yes.
Sometimes it's person-centered approach, which most of the counselors in Australia trained in.
Right.
It's like seeing the person as whole and behave in the best interest of the person and believing that the person knows better what they need.
Right. Learning from the patient.
Yes,
sort of
yes,
idea.
and accommodating just them there in a safe and engaging environment. And it's also healing, what research showing us, right? From Carl Rogers and his work. So the approaches are different, and don't be scared if one therapist working very differently from the other.
Like yes. No, I think that's a good point. It comes back to trying to figure out the connection with the therapist and if it's right. And that'll be down to them as a person. Like you said, the therapist is a human, but also how they've trained at university, how they trained after they finished graduating, and their own therapy too. Like, is that something that informs your own practice, like how you were?
Absolutely. Yeah. I think this is the main component of my what made me a therapist is my own experience on the client side of therapy, because I've been in therapy for many years and it changed my life in many respects. And I believe that every therapist needs a therapist.
Yes.
You know, I believe that it's very, very important, especially when you are loaded with other people's struggles, problems, emotions, difficult decisions. You need a place to unload. You need to, you need someone to support you too, besides your supervisor, who is a supervisor for therapists. They're supporting therapists professionally.
Right.
I'm talking about emotional support more. So I think that this is very important for me as a client. I would ask my therapist if they have a therapist.
If they had their own therapy.
Yes.
Yeah.
I think it's important.
Yes. Yeah. I mean, it's been helpful for me having my own therapy was so obviously you're preaching to the choir. I'm a convert. I really benefited from my own therapy, but then working with patients, feeling like you can hold hope too, and sometimes there isn't any as well. I feel like when you've been in that place of like, everything is like dark, all things are really, really rough, to kind of have lived something of a version of suffering and to have gone through,
of course,
a supportive or version of healing for yourself.
I think it's very important to believe in what you're doing.
Yes, that's it, isn't it?
If the therapy really changed your life in any way, and if you're practicing as a therapist, you have this vision. You have this living experience that this is something worth doing because it helped me at one point, and I think this is beautiful about our work.
Yeah. But what if you were someone who was, just, even to briefly go into
Yeah.
it, the approaches to therapy, right? If you're someone who's like, actually, I don't really want to particularly talk about my childhood, or I don't want to go there.
Yeah.
What would be the kind of, therapeutic approach you might want to look for? Or if you're someone who's like, no, I really want to understand the dynamics of growing up and the family, dynamics, my upbringing, how that impacted me. You kind of want to go there. Are there certain approaches, or do you
Yeah, I
think?
can just reflect on it here, like improvisation. I think
Yeah.
if you're talking about not touching on childhood and just dealing with here and now, solution-focused therapy, cognitive
Right.
behavioral therapy, it's all places to go,
Right.
definitely. And it would be again this short-term therapy, because we're talking about childhood not in order to relieve the traumatic experience or
Right.
blame our parents. We're talking about our childhood because this dynamics was so crucial for our development and building this template or blueprint inside of us, internal picture, basically, internal GPS of how to live our life, how to relate, how to struggle or not to struggle.
Yeah.
So this is why it's very important to zoom into that, to reflect on it, and to see what was really going on back then. But there are some approaches that not touching on it, and some approaches that are going very deep into it.
Yeah.
It's psychodynamic therapy,
Yeah.
of course, psychoanalytical approach, also emotional focus therapy, and everything attachment-based therapy,
Okay.
and
Yes.
attachment-informed therapy would probably go into your childhood just because attachment is forming from your childhood and your relationship with your primary caregivers. You still need to go there. Yeah, so I would say that you have choice to not talk about it, definitely, and every therapist will respect it. You can say in therapy at any point that, I'm not comfortable talking about that. It's your right.
Absolutely.
And in the same time, maybe you will find yourself in a few months in a place where you want to talk about it. Because sometimes the question from your therapist that wasn't answered in a therapy session would drive the insight and would drive you to come to the point that you want to talk about it. It's not what you said to therapist, it's what you took out of the session. And sometimes you're just taking the questions that wasn't answered.
And then you're sort of marinating on it and sort of thinking,
Yes.
hold on, what's that about? Or yeah. And why wouldn't you just talk to your mates? Why would you go pay a lot of money to sit down and talk to a therapist? Because obviously it's a massive investment financially in terms of time. And what would what's it's kind of hard to put words to it. What the kind of difference, but that
it's really a
between
good question.
a friend or talking to a parent or a friend or a family member and having that space with the therapist.
I'm just wondering, do you know any friend of yours who can give you undivided attention with no judgment for 50 to 60 minutes? And then not hating you and not bring you the bill after?
Yeah.
The bill, I mean, not that you need to pay it, but the bill in different version. Like, can you make me a favor to do blah, blah, blah?
Yes, I see.
This is the first thing.
No, that's a great, on a practical level, that's a great point, isn't it? Yeah.
Therapist is a trained person who can, first of all, who is paid for that time, but they, most of the time, genuinely interested in you, in your life, in your challenges. This attention is very hard to fake, I think. This attention the therapist is giving you also coming with professional background, with years of experience, and with clinical judgment, right? Let alone interventions, techniques that this therapist can use with you to solve your problem. So I think these things on its own already making a big difference between your friends and your family members. The other thing that your family members, they usually operating in the same family system as you. just imagine
Good point.
you're just trying to get out of this lake where you're swimming, and you're coming to the ducks in the same lake and asking, how can I get out of this lake? So they've been in this
Yeah.
lake for the whole life. They have no idea. But they can suppose that you can jump or swim, etc. If you want to go to take this road, it's your choice. With your friends, and like again, it's very, I think it's very important to have social connections with people. I'm all in for friendships and very deep connection with friends, and being able to have meaningful conversations with friends. But it's not replacement of therapy, just because friend has their own internal picture of the world, or their own blueprint and operational system, and they hearing you and digesting everything what you said through their lenses, right? The therapist ideally are taught to not mix up their personal feelings and reactions and vision and beliefs, etc., with what clients bring, right? They're there for you to serve your needs, while your friend is completely different story. So what I want to say, that what you can expect from therapist, you can't expect from anyone from in your life, basically. And it's very hard to be a therapist on our end because of this, again, undivided attention, no judgment, and other ethical implications that coming with being a therapist. Because it's a very hard job, but sometimes it's invisible for you, because all you see is,
Yes.
yes. But basically, I think Gabor Mate said that the pain to be gone or to be reduced, it needs to be witnessed. But witnessing the pain is basically the job of the therapist. And this witnessing on its own means that the person who is experiencing the pain is not in isolation. And isolation is what is causing and creating, it's one of the aspects that creating trauma. So by being witnessed with your pain on its own, already healing. And yes, you can be witnessed by your friends, and you should be witnessed by your friends. I think it's very important to being able to be vulnerable with your friends too. But the therapist is just providing you unique space, unique settings, and I think unique skills that are very hard to compare with other people in your life.
No, that's such an important point, isn't it? Just that it can seem like almost a bit silly. Like, well, why would I just talk about my feelings and then pay someone so much money to listen to it? But there's so many things going on in that process, including, like you say, the witnessing, feeling heard, understood, understanding yourself, but too better, sort of, and giving yourself, an opportunity to make different kind of sense or view on what's even happened, and to feel like not as alone in it, like you're saying, to feel.
And it's sometimes for some people, it's the first time in their life they experience when their pain has been witnessed, but they were not judged in it. They were not dismissed. Sometimes we're saying like, oh, it's gonna be fine,
Right.
yeah, but look at the positive side, etc.
Yeah,
And
of course.
this is first time like experience of safety and being met is creating this particular blueprint for the future. So once you know what it is like somatically know, cognitively know, you have this corrective experience, you will be able to recognize people who are able to provide you similar experience in the future. I'm talking about safe friends, safe partners. I'm talking about new experience that is familiar to you, that attracting, but not attracting, it's you choosing them.
Yes.
That attracting similar experience in the future, positive experience. You will be open to it because you know what it is like.
That's the corrective experience point is a big one, isn't it? I think that's often overlooked, like the power of that to be having a relationship with your therapist that is helping you understand the kinds of dynamics or
Is
characteristics
healthy.
that you want, in other relationships.
Yes.
Or
Of
relationships
course,
with yourself and with other people.
yes.
And
Of course, you can't expect people to be the same as your therapist,
yes.
but you can expect the safety that you feel in your body.
The physical experience of being in a relationship with your therapist.
Yeah.
Is something you can then forward in your other relationships and to have with yourself when you're sort of away from the sessions.
Yes, absolutely. Absolutely. In the end of the day, I read, I think, somewhere also the idea that resonates with me a lot. The therapist, the voice of the therapist becoming one of the voices inside of you that you're hearing.
I love it.
You know?
Yeah, absolutely.
Like what my therapist would tell me in this situation. Yes, you missed this opportunity, but you did really well. Look at
to have a more balanced, fair perspective.
Yes, absolutely.
A compassionate
voice that is following you through your life, even when therapy is done and dusted years ago.
Right, and it's something you carry through with you. I think that's something that's often not talked about enough. Is you're not just benefiting in therapy when you're in it, but when you leave it, if you leave it at a time in which it feels right,
absolutely,
you can carry that internal world, that sort of changed way of feeling in yourself
because
forward.
you're internalizing your therapist. You were with your therapist in the most vulnerable places. You been that open with your therapist that you're not open with anyone else. So, and you spend in the end intimate hours with your therapist, just you and your therapist, like particular amount of hours. All of this kind of contributing to creating this figure inside of you, voice inside of you, voice of your therapist that is there for you even when the therapy is years away.
I mean, I have just another thought around the fear that people have, with opening things up, sort of going there. Like if you might have, and there may be limitations. Sometimes you've gone through maybe things that are actually too raw, too painful. You don't want to go there, and for that reason, you might not go to therapy, or you might take the other door, or there might be reasons that you don't. You've got things that are too much to go into. But let's say you're on that kind of tipping point of, it feels like it's kind of almost too much to go there and think about certain things that have happened or things that you're going through. But you also want to go to therapy or you want to give it a go. Like, what's reasonable to expect in terms of going in there? Like, are you going to feel good every time you leave? Are you sometimes going to feel worse? Like, when you're going into hard stuff.
I think this is very normal for many people that we don't want to talk about bad stuff. We want to talk about positive stuff, our achievements, our wins.
Yeah.
And it's absolutely normal. And the therapy is not interrogation. Some therapists are dynamic, like me. I'm asking many questions. I'm very active. I'm not sitting back. Doesn't mean that I'm not letting my clients to talk, but I'm very dynamic. This is me. Some therapists are more person-centered and more not reserved, but giving you much more space to talk. And if you're not talking, they're not talking too. So you can sit in the silence, and silence is healing too. And silence is very important in therapy, as a therapist, probably that. But sometimes clients think that it's just waste of their time and money. Silence is doing the work too. But what I want to say is that every therapist is different. So if you're coming to a therapist and you're very scared that you don't want to open this can of worms, etc., you can just give this disclaimer in the beginning that I feel like it's too much right now for me and I'm not happy to talk about it. Every therapist wouldn't rush you into something you're not ready. You can go there step by step or opening just 1% at the time. And in the end of the day, immediacy, it's another thing that we're using in therapy. How it could be ironic, really, that some things in therapy that we are using, what is happening inside of therapy room, during the dialogue between you and your therapist, even the fact that you came late and you were stressed, how you parked, etc., all of this could be useful because it's reflection of you and your interactions with this world, with these people, etc. Your interactions with the therapist also part of it. So the therapist not necessarily always need to go into history.
I see. Yes.
Therapist not always needs to go into childhood. We can use here and now experience, which is immediacy, to highlight the stuff, to bring up to the surface stuff, to actually work on something. Even though it seems like, how could it be related to me, my traumas, my patterns, my gut health issues? But in the bigger picture, it is related probably to your stress levels. It's related to your dysregulated nervous system. It is related to how you're perceiving the situation, the world around you, and how you're building the relationship and what you're committing to or not committing to. So it's all interconnected. And it's not,
that's a reassuring way of understanding it. If you were frightened to go to certain places, or you want to go to therapy, but you're like, oh, I don't want to talk about that though, or that, or you can use the here and now understanding of what's going on to, in the way that sounds like the therapist is making inferences about, stuff probably went on earlier on, but we can just work with what you're seeing now to.
Georgia May, this is one of the approaches. We can use immediacy to actually work on some problems. But to be honest, even let's not talk about childhood problems. Tell me your favorite movie.
Yeah.
Tell me your favorite book. What exactly do you like about that? We are paying our attention and focusing on experiences, choosing songs or movies, etc., based on our internal picture.
So all of that is helping the therapist understand
exactly.
You don't have to talk about your first 5 years of life to the therapist to kind of.
I think quite good therapists can make sense of it through different kind of ways of knowing you. And help you to make sense of it too, of course.
Right. Yeah. So something as, simple as the kinds of movies you like watching or whatever, or the kinds of way you live your life day to day can all inform the understanding.
Even your favorite movie, how you will tell me that movie or the last movie you watched and it touched you, that you really remember. How you will describe this movie will be completely different story from how I describe this movie.
Yes.
Because you will highlight your struggles that you saw in this movie with this particular character, I will pay attention to my struggles and my kind of point of interest and challenges and other things. So this is why I'm saying, everything is interconnected. We don't need necessarily to talk about this particular painful experience. There are other ways, metaphorical ways too, and symbols, metaphors, all of this we're using in therapy to make sense of things that sometimes are very hard to verbalize.
Yes. Oh, I mean, that's such a lovely way of understanding therapy. Just all the things you've talked about today have really, in a way, just it makes therapy seem so much less intimidating and, manageable and quite exciting to give a go. I mean, I just think that you've been fantastic in the way that you've articulated the value of therapy. Obviously, yeah. I mean, I know I'm biased, and I'm a therapist too. But I really wanted to have space to explore, a number of kind of commonly asked questions around therapy, because it can be such a game changer when you've got gut issues or any physical problem.
Yes, of
could
course.
be related, to some extent maybe, but gut issues anyway, we know, stress and gut is so connected.
Yeah, I think someone called gut the second nervous system.
Right.
So because it's very sensitive and responsive to everything what is happening to you.
I mean, sometimes my body and gut knows that I'm stressed and or worried about something before my head even knows. Before,
And sometimes when we're coming to the new country or on holidays, we can't go to the toilet for a few days.
Yeah.
Adjustment that is happening there, it's very hard to realize it because, oh, I'm on holidays or I'm exploring new country, why I'm adjusting. No, I should enjoy it. It's a big stress for your body, for your nervous system, etc. It's new routine, new food, new
Change is
people around.
stressful.
Yes, exactly.
Yeah.
And your gut, like a mirror, straight away showing
Yeah,
you
like
that.
a mirror. Yeah.
Yeah.
Well, I would love to keep talking, but we have to finish together now. So I just want to say thank you again for coming on and talking about therapy and giving a really, articulate, warm, beautiful, gentle way of understanding therapy. And, if anyone wants to learn more about you and how you work, all your details will be in the link in the bio. But
Thank you very much, Georgia. I really enjoyed this opportunity to express myself and my passion and about
I can hear the
therapy.
passion. It's so alive in you,
Of
you know.
course. Thank you. Thank you very much.
That's a wrap for today's episode of the Gut Girl podcast. Thanks for listening. See you next time as we learn more real-world strategies for gut health. One bite at a time. Everything you've heard today is for educational and entertainment purposes only, and is not a substitute for professional medical or psychological care. While I am a registered psychologist, this podcast is not providing psychological services. Always seek medical advice from your qualified healthcare professional before making any changes to your diet, medications, or treatment plan. I do not necessarily endorse all the views and statements of podcast guests, and myself and the guests are not aware of your individual circumstances. Any advice given is general in nature.